New videos every day.
Psychetruth.
Life, wisdom.
Hi, I'm Dr. Bellonzi, and we're going to continue today demonstrating some chiropractic adjustments. We've done a little exam on Karina, and we found a couple spots that need to be addressed. So we like to get her in a sitting position first, or ideally actually standing up, but we'll continue sitting, get an idea of her posture and how she's moving. I told her earlier that I need her to maybe train her upper back strength a little bit. A lot of people get very tight in the chest and the pecs and in the biceps, and that puts the shoulders really far forward. And now the neck's in a bad position, but it also makes her roll forward like that. So I want to have good posture so everything's supported correctly. So we'll have you lie down, and I'm actually going to use the table. Now this table is a Flexion Distraction table, and it's actually able to put flexion and extension movement on her spine, and I can actually feel if her spine's moving with the table. So let's have you go ahead and lie down. And now we are going to strap you in. It's just so her legs move with the table. Let me see something actually. You are a little off. we gotta level you out. So now what I'm going to do is I'm going to use the movement of the table to help me not only figure out where the tightness is or the not moving joint, but also just to help loosen her up and even help me with my adjustment. Now you notice I have the table going a little bit into extension, especially when I have somebody that has a bad disc or something like that. If the extension proves out to be the better movement, then I can adjust the movement of the table as well. But I'm just going to feel how the vertebrae are moving as her lower extremities are coming up and down. And I can feel a couple spots down here that we're going to have to address. And then also in the upper back. See, right here is not moving really smoothly. So what I want to do is attempt to have everything moving along with the motion of the table. And I have a couple different ways that I can adjust. I've got what's called a drop table, and I can actually pick out the area that I want to move. I can take a specific contact as I can, and then I'm going to push down a little bit as the table moves. And I'm able to make an adjustment that way with more speed because the table is moving and giving more and more speed than my hands alone. Now I also can adjust without the drop piece. Again, I like to use it often with the movement of the table because it'll give a little bit of a traction while I adjust. I also found something up here. And it's actually loosening her back up as we keep the table moving. And sometimes people can get quite a bit of relief just from the table movement. So what I'm doing up here is I'm contacting the upper part of her thoracic or her upper back. We're going to use her head a little bit. And then I'm just going to give a little push, and we got a little release there. So that should help. Actually, now it actually feels like it's better in place. It's more aligned with everything. And now as I go through here, I find that I don't have places that aren't moving. Okay. Now we checked her leg length earlier, and I also want to get a couple things in her lumbar spine, but her legs are a little uneven. Most of the time that's actually a functional thing. Some people do in fact have a shorter leg, but most of the time it's in the pelvis or around the muscles of the low back that can actually unlevel the pelvis, and then you're going to have unequal stresses. So I want to get her leveled out, and I'm going to do a drop move first. So we're going to use the drop table again. And we're just going to give a little push. And I felt that move, so yeah. Do you feel how that's looser?
Yeah, I feel more.
Okay. So that we've got that, and then that's actually out right there. I'm gonna do a drop on it, but then we're also gonna go to what's called side posture. So I'm gonna do one more drop here and just bring it down. And see, that helped a little bit. I still want to adjust that a little bit better. But now we're getting things loosened up, and that's the whole objective, to have her spine freely moving. Go ahead and stop the table. And we'll let you go. See if you, yeah, see now you're fairly even. So we actually were able to make a correction, and you know, I'm happy with that. Okay. So now to finish up, we've gotten things loosened up pretty well. We've used the table. I'm going to have you lay on your right side, facing this way, I'm sorry. And I'm going to give you a little support here. So go ahead and just lie down. And really, I'm putting you in a position that gives me the advantage as far as mechanical leverage, right? So I want to put you in this position here. I'm going to get you off of your shoulder, and you can just fold your arms. And then I can pick out where I want to adjust. And I'm just going to take a little contact, and we're going to push there. And we got a little release.
Yeah, and I felt it kind of pop.
And then we're going to have you on this side. And here I want to get this, what's called the Sacroiliac Joint, a little freer. And I also had a lumbar vertebra still a bit tight. There it goes right there. And there we go. Okay.
Cool.
So now you can sit up.
I'm afraid I probably got mascara all smudged on my. Is it bad?
No, it's not bad at all.
Because I can see it on the little things there.
Yeah, we took an imprint of your face as well. So we'll file it away. But how does that feel? So we've got things loosened up.
It's really good.
We've got your hips leveled out. It should actually feel better even as you walk around.
Awesome.
So I hope you enjoyed that. I'm Dr. Vince Bellonzi. If you have any questions, you can email me at info@austinphd.com. You can also find our website, austinphd.com or austinpurehealth.com. Please do send questions, comments, anything like that. If you're in the Austin area, come by and visit the clinic. I'll be happy to demonstrate some of these things to you and help you out with any problems that you have. Thanks for watching.